Shalom, everyone, and thank you for joining us again on another episode of Crossing Boundaries. I'm Kim Passiosef, joining you from Israel, and together with me is one of our amazing co-founders at Majdi Tours, Aziza Patera. And Aziz, you actually wanted to open and talk a little bit about what happened in Lebanon before we introduce our guest.
Yeah, I just want to say I think we can't not talk about that, considering how horrifying what happened in Beirut. I spent the morning talking to friends from Beirut. I've been there. It's one of the most fascinating places to go to. Just the people, the hospitality, the place. It has so much history. Lebanon has the oldest port in the world, continuously used port in the world. It's almost just a little older than Jaffa, it's believed. But I mean, I remember when I landed in Lebanon, the first place I went to was the place where that was, blown up, where the explosion happened 2 days ago. And so I have such a strong memory of that spot. And I went there because it's not only a port right next to the port, it's also like a concert place. It's also where people hang out. It's a nice walk. And so I went there because there was a concert, and I landed, and a friend just called me and said, come over to here. And so put our bags in at the Airbnb and just drove right away to the port. And that's my first memory of Lebanon. And it's so heartbreaking to see the destruction. What I was told this morning, I talked to a very dear friend who's worked with me for 2 years before, Riyadh, who told me that hundreds of thousands of people are homeless because not only did the houses get destroyed, what we saw, but also also a lot of houses got destroyed within like 4 or 5 miles, even more away from the actual bombing, not bombing, explosion. So that's, I think that's something to think about. We add to it, most money donation going there, it's problematic right now because the banking system is a failure. So if you donating money, it's not necessarily going to be easily used there, which makes things just so confusing. The friend I was talking to runs an organization which now recruiting volunteers and going around fixing the houses, trying to help people get out, get back in, so they can get people back to their normal lives, getting them supplies, buying literally rooms and things to fix the homes. And any money's going, they're not able to get it out of the bank. So we spend the morning devising a plan of how we can get them what they need. And we're working on a plan where we literally gonna have to run project from the United States here, send them credit cards or debit cards, and that would actually work better for them to be able to buy things using an American credit card to be able to buy supplies. So I'm working with a few of my Lebanese friends on putting something together, and if anyone is interested in helping, we'll be putting that info online and sending you messages as well. But it's the devastation is a lot worse than what we could see on TV, and it's just heartbreaking. So just wanted to start with that. Hopefully everyone's thinking and praying for what's happening there.
Definitely, and I'll just add that, I mean, it's unfortunate, but also beautiful that in times like these, there's like no, or not no, but less of hatred between, Israel and the countries surrounding it. Israel automatically, at least on the news, said that they will offer help, and I know that Tel Aviv municipality had, that on their building, they always have like the lights show up to support someone. So they were supporting Lebanon yesterday, and assuming that will continue for a few days as well. And I think that a lot of Israelis at this situation think like it's so hard to be next door and not be able to assist. And one of the things that they've been talking about a lot on the news today is that they're really worried that the next place it's going to happen, this sort of explosion, is the Haifa port.
Right, because
They're
the same kind of material that
exactly
is also stored in Haifa.
right. So I think people kind of freaked out that it happened right next to us, and because it's like a ticking bomb.
Right. Well, let's move to our topic for today, and we'll probably have to do in the next couple of weeks. We'll figure out a show where we talk about Lebanon, and we'll see who can join us either from there or from here to talk about what's happening in Lebanon. But today we are talking about healing across the divide. Kim, do you want to introduce our guests?
Sure. Again, we're having our partners join us on a show. We're actually going to split the speakers for all through the show. We're starting with Norbert Goldfield. And Norbert, you're going to tell us a little bit about the organization, and then talk to us a bit about the program managers. And from there, we'll go to one of the grantees of Healing Across the Divide. And actually, I'll let you I'll let you start, Norbert. Can you tell us a bit about the organization, how it was or why it was founded from the first place?
First of all, thank you very much for having me, and I appreciate that the heartfelt introduction regarding the tragedy in Lebanon. And I have some contacts also, and I had wanted to make a donation personally, and they haven't gotten back to me for exactly the reason that you said, Aziz. So I think there'll be a time and a place. And essentially, and in a way, that really leads us to healing across the divides. Because as Americans and throughout the world, I mean, Europeans, Russian, Chinese, whether we like it or not, we are involved in the Israeli-Palestinian conflict. That's just the fact of the matter. And so I've been engaged in Israel since 1967. My first time. I started working in the West Bank in 1996 as a physician. And I saw no organization that was engaged in health, which is my field, on both sides. And so we started the organization in 2004. And the mission of the organization is to measurably improve the lives of marginalized Israelis and Palestinians through community-based interventions. We work with already existing groups, and you'll be hearing from one of them later today. And we have eyes and ears on the ground because we're trying to do is not only to measurably improve the health, we've done that for over 200,000 individuals, but in addition, we want to improve the effectiveness and the efficiency of the community groups that we're serving. And some of you know me, you know that I'm a dreamer at heart. But probably won't happen in my lifetime, but I absolutely and passionately believe that some of the leaders of some of these groups could be tomorrow's political leaders. And in a very, very small way, we will have had a hand in that. But as we go through, we have both Israeli and Palestinian representatives who are remarkable in their own way. And I'll briefly introduce them. First of all is Marganit, and second one is Nihad. Both of them are just amazing individuals. And as my wife says to me, I'm the lucky one to have started Healing Across Divides. I'm the lucky one to have met Marganit and Nihad. And the bottom line is that they never would have met each other without Healing Across the Divides. So I'm going to hand it over to them. And that's what's great about a strong organization, is that I'm a small but important, but a small part of the organization.
Before you leave us, Norbert, and thank you for the introduction. I know that, well, you spoke about being a doctor. Can you just discuss a bit about COVID and the effects of COVID on your organization, or also on the future of travel?
So with respect to the organization, for example, this coming Sunday, we have a meeting with all the Palestinian grantees. So we talk about the fact that we try to bring all the grantees together, those that are willing and able. It's much more challenging today, even with Zoom, to do it because of the overall political situation. But on Sunday, we have a meeting with all the Palestinian grantees, and we have a grantee in Gaza also, where the entire focus is going to be on the development and refinement of apps that can be used to facilitate communication. So as an example, we have an intervention that's being pioneered amazingly by an intervention that was developed at Stanford University for type 1 diabetics with who are teenagers. And I can tell you that these teenagers would much rather be on their cell phone, on their app, talking about diabetes, and therefore they don't have to talk to their parents or their doctor. Now, our challenge is to encourage refinement of those applications. That's the positive. The negative is, very briefly, is that we have an intervention of an urban farm between Israeli Bedouin and Israeli Jews. Part of the intervention involves kindergartners looking at increased communication of the parents and improved nutrition. But frankly, the kindergartners can't meet because Yeroham, which is the town, a Jewish town, is a hotspot for COVID. With respect to the future of travel, I will do my best. I have lots of patients who have COVID, several of whom have died. We will adapt. We are human beings. We know how to adapt. And for sure, we will definitely adapt. And we are very excited about working with Mejdi, as we have already for years, for the 2021 tour.
So, well, you bring me to my next question because you talked about our partnership. Can you talk a little bit about the tours that we run together? So
frankly, the study tours that Mejdi operates are unique. Having a dual narrative tour is actually only scratches the surface. Having amazing food only scratches the surface. The reality is we have these intense conversations. It's facilitated by the fact that we have both of our representatives who are engaged, but what we have is just an intense engagement, meeting with grantees that Mejdi facilitates, being at wonderful hotels and having these great conversations. And of course, it would not be appropriate to not mention in a very strong way that we have a dinner at Aziz's father's home in East Jerusalem, which is just amazing. Not just the food, but there's a political context that you have to appreciate by being there. So that really is in a nutshell, the study tour is seeing this amazing man who has not given up hope, this father, despite his challenges, while having wonderful food in a part of the region which is highly challenging from a political situation. That is the Mejdi tour experience.
Thank you, thank you. Well, let's move then to Marganit and Nihad. And I wanted to, I guess it would be a great way to start to ask you, what's your involvement with Healing Across the Divide and what brought you in? Marganit, do you want to start and then we can move to Nihad?
First of all, thank you for inviting us. I told you before, I live so near to the border, to the Lebanese border. So thank you for everything you said. It's I feel like in the last few days, my heart is partly in Lebanon as well as in Israel. I was lucky enough to join, I'm the last to join the AJTD staff, less than a year. And I'm already feel really lucky getting to know the staff and the organization, which I know for many years. And of course, the organizations we're working with. And I think it combines between things that I'm really involved, which is the marginalized community. I live in the periphery of Israel, together with health and health equality and grassroots organizations. So for me, it was just a perfect foundation to join. So I feel really lucky to join this organization.
And what is it?
Oh.
Sorry.
Should I go?
Yeah.
Yeah,
Okay.
go ahead.
So I joined the organization in 2016, and at the time I was working with USAID in the West Bank. So I'm situated in Ramallah in the West Bank, and was looking for, my projects had ended and was looking for work, and Sam Bahour introduced me to Dr. Norbert, and we got to know each other. He told me about this organization, and I thought, an organization working with Israelis, that's something I have to get vetted by my husband. That's always our ongoing joke, because he always says I'm a little naive about things. Anyways, after it was vetted and approved by my husband because of the situation and how it's just very, lines can be skewed between working with organizations. Anyways, after all that, found out that Healing Across the Divide is an amazing organization. They do great work. So I applied for the job and was hired, and have been doing this work for the past 4 years, and I love it, and I love the work that we do. I love working with the West Bank grantees. We give a lot of small organizations, grassroots organizations, an opportunity to grow, and that's hard to do here, and I've been happy since. So yeah, that's kind of how I started.
That's wonderful. Thank you both for joining us today. Can you talk a bit about the grantees that you're working with today? Maybe mention one that is close to your heart, or any special memories that come up when you're talking about the grantees? Nihad?
Yeah, sure. So to date, I've worked with 6 different grantees, and I think we're going to go through the slides. The current ones are 4. But I guess they're all close to my heart, because as Norbert says, a lot of these women that we work for, and they're mostly women that we work for, are really, could be future leaders of Palestine. And so I just feel so proud to be a part of that, and seeing their growth, and seeing them build their capacity and learn how to, for some organizations, for the first time, having a stay-at-home mom become a project coordinator and run a project, which is ABCC. But I guess if I had to pick one, it would be Yes Theater. And Yes Theater works in Hebron, and they do drama therapy for children and youth and women. And I guess that one's closest to my heart, because when I go to those sessions and see these kids and how happy they are just to be able to have a platform, to be heard, just makes me so proud, because of the situation, especially in Hebron, and where they're working in the old city in Susia, and seeing these very dedicated Palestinian women counselors and men, just so committed to work under our circumstances, being under occupation. I mean, it could be heavy, and we give them this platform, and the women keep working, the counselors keep going, the children keep coming, the women, who attend also are very open. And so I guess that would be the closest one to my heart, is just the work that they do there, especially because Hebron is a very politically charged area. And so for us as HATD to support a group like that, it really means a lot, because they need it.
How involved are you? Meaning, I know some grants work where you get some money from an organization, you never talk to them again. Some they come and visit a lot, some they mentor you, some. How involved of an organization are you, for example, with the theater? What do you do with them in addition to supporting them financially?
So part of our work is also to help these organizations build capacity. So not only do we fund them, we also work with them to develop work plans each year, to make sure that they are able to implement what they're saying. We help them find indicators to help us and help them also measure the impact of their program. We work with we work with them to develop different tools to see the type of impact that we're doing, and make sure that we're not just giving money to give money. We also want to make sure that we have, like Norbert said, measurable outcomes. And so that's one. We also provide training to not Yes Theater, but other groups. We provide trainings. Again, that's in order to help build capacity. Norbert himself has come out here a few times. I mean, comes out often, but has come out and actually provided the Stanford program training to different organizations. So it's not just about money. We do oversight, we do site visits. We're there. If they have questions, we support them. There's never anything that's wrong. We give them the forum to explore different avenues, and then we guide them. And then we also have different people who volunteer. We have Professor Humbry, who's a professor that Norbert knows, who's volunteered her time and was doing psychosocial counseling via Skype. This was a few years ago. It would have been Zoom now, to help counselors in one of our projects, where they would just do case studies and would provide feedback and supervision on individual cases. So it's not just about money, for sure. There's a lot more. There's a lot invested on our part.
Margarit, do you want to add a bit about the grantees that you're working with?
Yes, sure. So at the moment, we're working with 2 organizations, and hopefully B'Terem, that will speak soon, will join us further in the year. We work with Cucinate. It's an asylum seeker organization that provide a holistic help for women, for the asylum seekers, both. Yes, this is like great picture. It's both group and individual therapy, together with income generating craft that they learn how to do. So it's a whole holistic approach. And we just visited a few weeks ago in Tel Aviv, a pop-up store that they're doing, and it's beautiful. And as you can see, the masks are amazing. At the moment, it's harder because of COVID challenges. So not all the women could come to the studio. Some of them had to go back and work from home with the kids around, which is a bit, it's of course more complex. And with the therapy, it's a bit more complex because not face-to-face encounter are allowed now. So they were trying to help them with phone calls and be in touch with about 300 women. So it's challenging at the moment. But I think they managed to do the most out of the situation and still working. I mean, because what happened is that many people, of course, lost their jobs, and it's always the asylum seekers who suffer the most. So many of them, they just got in a very tough situation. So just generating some income at the moment is really crucial for them. So that was one organization. The other one is the White Hill Farm. And it's great because it's an actually outdoor activity. So families can come over in the afternoons, even in the summer. And now they just got some huge tents that they're going to build, so they can, you know, it's really sunny in the south, and so now they can have some nice outdoor activities. And I'm just thinking about one of the stories. I just read their evaluation forms, and they talked about one of the kids from a kindergarten from Yerucham, and he was very shy. And they said that once he went out to the farm, he started to become very active and very happy, and started to talk. And so we talked about how health is not the absence of illness. It's about having physical and mental and social wellness. And it's something that I felt like the farm is bringing and allowing to those kids and their families, and of course the teachers. And COVID is challenging. We just don't know, you know, what will be in the school year. So it's hard to imagine how the year will be. I worked for the NIF, for the New Israel Fund, for 10 years as organizational consultant. So I worked for many years with NGOs and with social entrepreneurs. And I think that it's great that AJTD is allowing us not only, you know, to allocate some funding, but do this really close work with our grantees. I think it's a wonderful opportunity to get to know them and work with them.
Yeah, and I know that the travelers on the tour that joined the Healing Quest Advice Tour to Israel and Palestine actually get to meet some of the grantees. Can you tell us a bit about those meetings? What do they get to see when they're meeting with your grantees?
They get to meet the leaders of the program, and in some instances, they can actually go through some of the sessions that we provided. I know that one tour once we had at the Family Defense Society in Nablus, which was a group that we funded that was combating obesity for women living in the northern West Bank. And during that visit, for example, we had the woman who was there on physical education actually present or do a session. And so our group, our study tour, was able to sit through that session and engage and learn ways to do moves, not at a gym, because sometimes, you know, culturally it's hard for some women to, one, get to the gym and to afford it. And so part of this program is teaching women how that you can get healthy and do it all at the convenience in your own home. So that's one of the things you'll experience. When we were visiting ABCC, which is Ahel Balata, and also in Nablus and Balata, we were able to tour different areas around Balata. So these are some of the women during, so this photo, actually, I don't mean to go off because I love this photo. They're wearing their masks and they're out doing their physical exercise again, and this is done in the center itself. So these are some of the things that you will see with the grantees. We try and visit as much as we can. We do try and get a tour to Ramallah, which is what a lot of the visitors ask for. We've done it only once, but we hope that we can continue to do that. I love showing people Ramallah. So that's also it. And then and another one, which we're not funding them this year because we're done, was the Women's Working Society. So in that tour, we went to actually Susia and met the people living in the area, and there's a lot of history around that, and disputed land is what they say. And so we met a lot of the women living in the tents out there, and the children going to school there in the Susia area. So it's a variety. You get to see different things.
That's awesome. So let's bring in one of your grantees. We'll start, I believe, with Orly, and so we can hear something from them as well and learn about how these projects affect them. And let's see, Orly is already here. Hello, Orly.
Hi, hi to everyone. Thank you so much for inviting us to be here. Really an honor for us, since we're working together with Healing Across the Divides for more than 4 years, saving the lives of the children in Israel, promoting safety and injury prevention. And it's a big honor to be here today. Thank you.
And can you tell us about your organization, B'Terem, and what's that organization? Why was it started, and what does it do?
All right. Just before I'm going to say something about B'Terem, I want to say and join my friends with the condolences for the Lebanese, and hope things are getting better in the future. So sending them big hug. And then B'Terem. B'Terem in Hebrew means beforehand. The organization was established 25 years ago by 2 pediatricians who are working in an Israeli children's hospital. B'Terem's history begins with a little child who was 1.5 years old. She was admitted to the ER since she had taken some caustic soda balls, and she swallowed them, the types that we're using for clearing plumbing blockage. Dr. Chemo, one of the pediatricians, encountered her in the ER and treated her at the trauma room since she was in a life-threatening position. And then afterwards, she was admitted at the intensive care unit, where she was for 4 years and had 14 operations. Dr. Chemo treated Shakra at that time, and she got to know her story. Shakra is one of 200,000 children who get admitted to the ER each year due to injuries in Israel. Shakra's story really was frustrating for Dr. Chemo, and since her training at school was being a pediatrician, she thought, and she was taught, that she's going to take care of sick children. But then she finds that 1/3 of children who admit to the ER are due to injuries. And that was the moment that Dr. Chemo thought it was a good idea to establish a center to prevent these injuries, since most of the children are not supposed to admit the ER. So each year in Israel, we're losing 116 children due to injuries. And if we look at the Arab society, the probability of an Arab child to die from an injury is 3 times more than a Jewish child. And if you're looking at the early ages, it comes to 6 times more. If we go to the Bedouin community, well, this means even higher, and the probability of a child from the Arab sector of the Bedouin is a little bit more than twice than an Arab child in Israel. So another risk population is the ultra-Orthodox population. Most of the poor children has a probability of dying from injuries twice more than every other child in Israel. So we have these 2 risk populations. The project that we did with the Healing Across the Divides was regarding the Arab society, where we brought together some grandmas from the Arab society in the north, and we built together with them and a special community center in Turan, a special group who was first supposed to take care of their own health and then help the society. And for 3 years, they really built their special project where all these ladies were called, instead of their name, Mrs. B'Terem, the lady who knows everything about safety. Everyone of the community was coming to them, consulting with them about their child safety. They promoted safety from the morning till the night. They got to be a very, very committed group, one to another. The community was around them. The municipality was working with them. And the important thing that I would like to say is that together with the Healing Across the Divide, which is sometimes, you know, we work with a lot of foundations. Most of the time, foundations give money. Healing Across the Divide didn't only give money. They were our partners. We were partners every day. When it was hard, we was talking together. When it was hard, we solved problems together. When it was not hard, we thought of how we're going to do it together. So I think we had a connection, I say, a very special connection, connections of people who really wanted to do good together, and 2 organizations who brought to the field a lot of experience which would, you know, put things together and get 1 and 1 better and greater than 2. And so after 3 years, we have a really change in Turan, in attitudes, in the way of living, change of, you know, ways of acting. And mostly, we have a community who is very proud of being better in child safety. We have a community who really appreciate community work. And we have people who didn't appreciate women, and they're looking at these women as angels who changed the lives of the children in Turan, and we have less injuries. So this is what I say about partnerships. It's 1 and 1, even 5. As I was taught in mathematics, it was only 2. Working together with Healing Across the Divides, we're more than 5. Just another thing what B'Terem does in our field, we promote public policy. We have a very professional research group. We have data about child safety, which we work with the government. We get data from hospitals, from the media. We adopt things from abroad, change them culturally, and promote them to community outreach and outwork. And we work a lot with explanation about spread of safety messages. So we would like the Israeli population to adopt a safety culture. It's not yet in Israel, although we know it happens in the United States and some other European countries. And most of all, we're really targeted to changing the way the lives of the children in Israel. We are focused to be very effective as an organization, although we are an NGO. And I'm just proud to say that together with our partners across Israel, whether it's another NGOs, government, or the private sector, we succeeded to decrease the death of children in Israel in the last 20 years by 53%. And today, more children are living. We saved the lives of the children, but still we have such a long way to go. And many more years to do the right things. And when we are finished, we're going to go to another field.
And I mean, I'm sure that COVID has brought up some new challenges with these safety issues. But thank you, Orly. And before we continue, I have some more follow-up questions for you, but I know that one of the grandmothers from the project is listening, and it might be interesting to bring her in and ask her a few questions.
Our angels, you mean?
Your angels, one of your angels. 100%. I mean, if she's taking part in this amazing project and that's actually saving lives and changing the statistics, she deserves that title. Hi.
And I believe I'll be translating. Let's unmute Khalida. Here we go. Marhaba Khalida. So Khalida will speak in Arabic, I believe, and I'll translate to English.
I think she's still muted. Sorry, everyone, for technical difficulties. One of the questions we had to begin with when we were building this show was, do grandmothers know how to use Zoom? So it's, I mean, we're fortunate to have Khalida with us. I don't know, Shannon, maybe you can unmute her or?
And request.
Maybe until you unmute Khalida, I would say that I know her personally, and she's not really only one of the angels, she's one of the leading angels. And what I found there is such a passion of giving from yourself. Sometimes when you have to do things for your family, they go out and do things for the community. And I think this is something very, very special. There's many things in Israel that are happening. You found her? Okay.
I think so.
We've managed.
Khalida, can you try to speak? تقدري تحاولي تحكي عشان نسمعك، نشوف إذا سامعينك.
مساء الخير، مساء الخير.
مساء النور، سمعناكي. كيف حالك؟
أهلا، الحمد لله.
Okay. Kim, you have a question. So,
sure. I mean, I would love to hear a bit about her experience of the project itself. What kind of change does she feel that she made on the community?
احكي لنا شوي عن تجربتك مع بتيرم وشو الأثر تبع هاي التجربة المشروع اللي دخلتي فيه.
مساء الخير. أول شيء مشروع بتيرم أنا صار لي متطوعة فيه تقريبا 5 إلى 6 سنوات. مشروع كثير كان حيوي وإيجابي عندنا في القرية. إحنا نساء متطوعات أخذنا على عاتقنا يكون في لنا تأثير إيجابي في التغيير بالمجتمع.
هلا خليني أترجم كل شوي تعطيني اللحظة. I've been part of this project, she said, for 5 or 6 years, and we are a group of women who wanted to have a positive change in our own community and to volunteer to help our own community. تفضلي.
التأثير الإيجابي هذا فكرنا إنه نوجهه أكثر للأطفال، لأنه في عنا كثير مخاطر اللي بتحيط بالأطفال بالبيئة اللي موجودة عنا، في إصابات اللي بتكون غير متعمدة تسبب لأذى كبير وممكن تسبب لوفاة في بعض الأحيان لأطفالنا. فكان توجهنا إنه ممكن نمنع الأذى عن أطفالنا.
We especially wanted to focus on children. We wanted to find ways to stop children from getting hurt because that can happen quite a bit in our community and it could lead even to death. So our focus was looking at kids.
بعد قبل 3 سنوات دخل عنا كمان إضافة لمشروع بتيرم للتطوع اللي إحنا كنا نقوم فيه فقط في المدارس وعلى نطاق ضيق حوالينا في الأسر. دخل لعنا مشروع هيلينج مبادرة باتريك، تامي، أورلي، جاليا، كلياتهن أخذنا كمان دورات ولقاءات إرشادية اللي ساعدتنا إن نقوم بالمشروع هذا بنجاح في القرية تبعتنا.
And so we worked with schools, and 3 years ago we got involved much more with Healings Across the Divide, where the organization, she mentioned obviously the people working the organization, she said they provided trainings and guidance on how to get involved more.
I have a question actually for both guests. What kind of message do you have to the listeners and in general to the Israeli-Palestinian communities that can help them both get involved more in these projects and also how to promote safety or child safety?
Maybe I'll add to that is like, how do you really do it in schools? So السؤال اللي سألته كم إنه شو الرسالة اللي لك للناس اللي عم بيسمعونا، كيف إنهم بيقدروا إنهم يساعدوا، والشيء الثاني كيف بتقدري إنك توصلي، كيف توصلي هاي الرسالة اللي هي الأمان للأطفال للأولاد في المدارس أو مع عائلاتهم، شو الرسالة اللي بتوصليها، شو الناس بتقدر إنها تعمل، كيف أنت عم بتوصلي هاي الرسالة؟
أول شيء الرسالة اللي بحب أوصلها، آسف، الرسالة اللي بحب أوصلها للنساء إنه كلياتنا باستطاعتنا، كلنا بنقدر إن نعمل تغيير، بنقدر نحافظ على صحة أولادنا. في طبعا ما بيجي الإشي بس بشعارات، إحنا مجبورين نعمل عدة شغلات اللي نشتغل فيها. فممكن إحنا نوجه، نعطي إرشادات لنساء اللي هن مثلا ممكن يكونوا حديثات الولادة أو جدات اللي هن صار كثير تعبانات من الأحفاد ومن الأولاد، ممكن نوجهن لتحضير بيئة آمنة في البيت. ممكن نتوجه للمدارس، نعطي إرشادات للأطفال أنفسهم، للمعلمات، لأمهات الأطفال، نعطيهم إرشادات بتجهيز بيئة آمنة للطفل داخل البيت، في المدرسة، في الساحة، في الحضانة. وكله أكيد بده يتبع كثير مشاريع.
She said there's a lot that can be done and can't be only in slogans. It needs to be actual work. So I work with mothers who just first-time mothers and how they can take care of the kids and make a safe environment for those children. Work with the grandmothers, and same thing. How do you make safe environment for kids, whether it's also in kindergartens or in schools? All these places. What are the steps you have to do to make those places safe for kids?
Thank you. Orly, going back to you, I know that, well, here there is a question asking you to speak a bit about Bnei Brak, but if you can also answer that same question about, you know, your message to the listeners and your message to the community about keeping child safety.
Okay. So as I said, the second risk group that we have regarding to injuries in children is the ultra-Orthodox community. And so Healing Across the Divides really brought up the challenge, and they combined with us to try and have the next project developed for this community. So we wanted, since Turan was a very good experience working with volunteers, we thought of adopting the idea and promoting a new project in an ultra-Orthodox community. And Bnei Brak, who is a municipality that worked with us in the past, said that they're willing to have the challenge together with us. So we're trying now to bring up the next project and to develop a special project which will be culturally adopted to the ultra-Orthodox community, having special messages, special way of operating and acting in this community, since it's a very low socioeconomic community, and since we have to bring up things that are really appropriate for the way of their living and the way the messages they have changed. And if you asked about, what's happened here in the COVID for us, so we have to change the way of the way we work from one place to another, since it's not so easy to work at the community level. And much of our work is community outreach. And so we're working together today with our volunteers, with our partners around the community, to find a way to spread out our messages, to have our community work passed by special ways. And only today we had a meeting where we thought of having the pictures of our volunteers, having videos of our volunteers, saying to the parents, saying to the families what to do, giving the way to connect them, to speak with them, have a house visit through the, the iPhone, and changing the way that we work. And Kim, you said, does grandmas know how to operate the Zoom or the other ways? So everything is being built with our volunteers and with our partners to make sure that we're not bringing something from our workrooms and then it doesn't fit in the community. And I think we have a big challenge, but I really understand and believe that if you have a will, you have a way. We have to save the children's lives. So asking me about the message, we're telling parents today, don't say it won't happen to me, because injuries in children happen to families from the Jewish community, from the Arab communities, secular, ultra-Orthodox, to rich and to poor people. So it happens to everyone. It might happen to everyone. So don't say it won't happen to me. Adopt the way to
Orly,
save children.
Here says, can you tell what type of injuries are you talking about?
Yes, the WHO talks about 4 fields of injuries. Injuries that happen at home. It can be poisoning and drowning and electricity shocks and suffocation and cuts and burns. It can be out of the home, around the home, backwards car accidents. It can be drownings at pools, or drowning at the seas, or just water holes. It can be at schools, or it can be on the roads, something that we know, as passengers and as pedestrians, as bike riders, and we have the electricity bikes, which are very common in Israel today. So this is 4 fields of injuries. If we go to some children around 16, 18, we have also work injuries. And we believe that it's going to be raising, since the economic situation is not so good now, and many parents won't be able, to give their children money, and some parents doesn't have money for themselves. So we believe that in the risk groups, many more children will get to work even in early ages.
Mm-hmm. Thank you. I'm listening to this. I'm like, well, I've done half of those things myself. Yeah. Got myself electrocuted, I think, when I was 8 or 9, but that's only one of them. Well, thank you, خالدة. شكرا كثير على الوقت اللي أعطيتينا إياه، وشكرا على كل شيء عم تعمليه أنت والنساء اللي معك اللي بيحاولوا إنهم يساعدوا الأطفال بمنطقتك. Kim, I think we've come to the end of our show, and it's time to thank Healings Across the Divide. Amazing work you're doing, and all these organizations that you are able to support, and all these individuals. It's been definitely an honor for us to partner with you in the past few years, and we look forward to continuing our partnership. We're very, very grateful and very proud of what you do.
I think Nihad raised her hand. Maybe she wants to add some closing statements. But I also want to say that if you want to get involved with Healing Across the Divide, then definitely go to their website. We'll link it here on the chat soon, and you can also find it on our Facebook, and we'll add it on the email going out later.
So you
So feel free.
had, I don't see Nihad being added yet.
Can I say one word, please?
Go ahead.
Just to finish, I would like to say thank you for a very, very important person for me, for us. Norbert, he's a visionary. He's a very special person. And Norbert, personally for me, from the kids in Israel, thank you so much for your kindness, for your battle to bring on the projects that you do for saving lives and health. Thank you so much. A very important person for us, and partner, friend.
Thank you. Nihad, did you have something you wanted to say?
Yes, I just wanted to also thank Norbert, since we're doing this, but like I said, very proud to be part of this organization. I just wanted to let people know that if they do want to know more about us, obviously go to our website, hatd.org. I think that's the name of the website. And to also like us on Facebook. We have a Facebook page, and share our link with other people. It'd be also great if you guys learned about our study tour. We are planning one, I think, if things clear up. Maybe I'm being optimistic. But in 2021, April, we are planning to do another study tour. And to please consider joining the tour. You get to see both sides, from the Israeli side and from the Palestinian side. You can see how people live together and how people live differently, and so it's a really great experience. And so I just wanted to plug that in, and always looking for donations. So if you want to help in other ways, please, we have a button on our Facebook page or on our website. So please, if you're willing to give a little, we're here, and the money will go to good organizations.
Thank you, Nihad.
You're welcome.
Great,
thank you, guys. Thank you, Majdi, for
Thank
putting
you all
this
for
together. Thank you so much for putting this together. This is great.
Always.
Yes.
And this is why when we talk about travel, we talk about it's not where you travel, but rather how you travel.
100%. I want to thank all of our guests. This was super interesting, and I will definitely want to join as much as possible, meeting the grantees and seeing them face to face. Just one sentence about next week. We're having two interesting human beings. We're going to have David G. and Shelley joining us. They're going to talk about mindfulness, mind, body health, wellness. You can start looking at David G's website and kind of learn about his philosophy. It's going to be very interesting. And again, partners of ours that we love hosting on our show. So thank you again, everyone. Thanks, Aziz.